Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. Chris Holman here, coming to you from Studio B, which you're all well acquainted with. We are going to spend a little time right now with Max Richtman. Max is the president and CEO for the National Committee to Preserve Social Security and Medicare. Max, I will tell you, this is a subject very near and dear to many of us. How you doing?
Right. I'm good. Thanks for having me.
Well, it's good to have you on the show, and it's good to see the work you're doing. Would you explain to everybody, just as a starting block here, what the National Committee is all about?
Well, the National Committee to Preserve Social Security and Medicare is a membership organization, members from all over the country. It was founded 40 years ago by a former congressman by the name of James Roosevelt, who had retired from serving in the Congress from California and wanted to preserve what he felt was his father's greatest legacy. And his father was President Roosevelt, and that legacy was Social Security. So we've been doing that for the last 40 years. I've been the head of the organization since 2012. We're committed to not just preserving Social Security, but enhancing it, protecting it, improving it. And of course, we've added on a number of years ago, President Johnson's, I think one of his great legacies is Medicare and Medicaid.
I'm absolutely in concurrence with that. So we were talking about this that many years ago, and foreseeing probably a few problems at that point. Why is working on these two topics good for not only older adults, but younger people as well?
Well, I'm glad you asked the correct question, as usual. Social Security is insurance for families. Yes, it's important for older folks, for retirees, to protect them, give them some sense of security, financial security. But, you know, we hear the term FICA. Not everybody knows that FICA stands for Federal Insurance Contribution Act. It funds old age survivor and disability programs. So this is an important program, as you brought up, for younger people as well. You know, here's a statistic that I found startling when I first heard it. A 27-year-old worker with a spouse and 2 children has right now, never mind what happens when that person turns 67, the normal retirement age soon for everybody in Social Security. Right now, that person has almost $2 million in value of life insurance and disability insurance in the event that something bad happens in the family and the breadwinner becomes disabled or dies young. So this program has lifted more people out of poverty than all federal programs combined. Millions of children get by in life because Social Security is there for them in the event they have a parent who died young or became disabled. So we're trying to engage younger people in the discussion, and that's why I'm here in Lansing.
Well, and the interesting thing is I'm not so sure we know much more about lifetime financial intelligence than we did 50 years ago. So this is pretty essential. Can you explain a little bit the correlation or the relationship between Social Security and Medicare?
Well, there are programs that hand in glove. They provide financial security, basic financial security, not luxurious financial security, and healthcare security. So these are the two, I think, pillars that are so important for our society. And we're doing, along with AARP, our partner in these town hall meetings, we call them Social Security Here Today, Here Tomorrow. And we're trying to spread the message about the value of these programs and differentiate the facts from the myths.
So final question, probably, answer me this. In 2034, suppose I want to start drawing my Social Security. That's when the fund is expected to be reduced. What what advice would you give me? And is that still a strong potential?
I would tell you to go talk to your member of Congress, talk to your senators. That's what I'm encouraging our members to do. We cannot get to 2034 and have this Social Security program reduce benefits by 20%. That is not going to happen. And in order to make sure that doesn't happen, I think the public has to start communicating effectively, consistently, and forcefully with their members of Congress. They need to fix that. And it can be done. It's been done before. The solvency was extended in the early 80s by 50 years. We can do that again.
You know, it's interesting. We got about 30 seconds left here, but there'll be a disparate impact on communities of color. Can you tell me about that?
Well, that's absolutely right, and pretty basic reasons for that. Those communities have less savings. They are likely to have lower pensions if they have pensions at all. They rely on Social Security more at a greater percentage than the general public. If it weren't for Social Security, communities of color, I think about half of them would be living in poverty. So it has particular impact, a powerful impact on those communities.
Well, Matt Richtman, President and CEO for the National Committee to Preserve Social Security and Medicare. Godspeed, my friend. A lot of people waiting on your success. All right.
Thank you so much. I appreciate it.
Good to have you with us. You've been watching the Michigan Business Beat on the Michigan Business Network. I'm Chris Holman, and we'll be back with more.